My name's Matthew Kenny, and I'm a part of the AMHS Health Studies program. I was super excited to hear that AMHS was starting the Health Studies program when I was a freshman, because coming into high school, I knew that I wanted to pursue a career in healthcare, but I wasn't exactly sure what that would look like. So I was really excited to have the opportunity to kind of explore the different career options I have in healthcare. And that's something that the Health Studies program has really helped me with in my high school experience. So I have absolutely loved working with Dr. Wellenstein. She's someone who has such a depth of knowledge and has so many experiences that she's open and willing to share with all of her students. So that's been something I've really cherished about being one of her students. And also having been with her for 3 years out of my 4 years in high school, something I've noticed that she really deeply cares about each of her students and their success. So that's something that I've been really thankful to have had in a teacher like Dr. Wellenstein.
My name is Bethany Carino. I am part of the Health Studies program, and I am a senior at AMHS. I chose to be a part of the Health Studies program because I am interested in pursuing a career in the medical field, and I believe this program would help me do that. Being a part of the Health Studies program has definitely been the highlight of my high school career because I've been able to work with classmates who are also interested in the medical field, work with Dr. Wellenstein and Mr. Weir, and be able to go on field trips to healthcare facilities. Dr. Wellenstein has been always accommodating whenever I need help and willing to stay after school.
When I started here, Dr. Wellenstein was the department chair and really helped me get going as I was really a very new teacher. And so she was a great example for me, not only in instruction, but in teaching me how the school worked and just how to go about being a teacher in general. Gail pretty clearly always held her students to a really high standard in the classroom, and it was really nice to be able to emulate that and see that set as a standard. It was much easier for me to try to do the same thing when I knew another teacher who was really pushing that. And it helped me not sort of let the students just slip back into sort of an easy class. In the department, that just meant that it was really clear what we were supposed to do, and not only were we supposed to hold our students to a high standard, but we were held to a pretty high standard ourselves, not necessarily in a punitive way, but really an encouraging way. She really wanted us to teach well and do good things for the students. I think as a department chair, she's been an excellent example for me as well. I've taken over the role as department chair now, and when I think about what I should do or how I should do things, very often the first thought that comes to mind is how would Gail do it? Gail's always got really fun stories about her time as a physician, sometimes some kind of gross things, but always entertaining and always illustrating a good point. And so I can use those or reference those in class, and it's been good to be able to draw on her experience as well, especially as I teach anatomy and physiology. The care that she's taken setting up the program and putting it all together has made it, one, function well over the last 4 years, and two, given us a really good guidance for where it should go in the future, set us up in a good place so that the program can continue even after she's retired. I've seen over and over again students who come back afterwards and talk about Dr. Wellenstein's influence on their lives, both in an academic way, how her classes really prepared them well for high-level work in college, but also in a personal way, that they felt like her classes and getting to know her helped direct them towards a healthcare career in some way. I've seen her legacy in that regard as well, in her influence on the students that we've had after they left the classroom. But I also look at the school itself and the way that we operate, and I think that things often operate in a logical, consistent, and highly professional manner because of her influence.
I'm Gail Wellenstein, and this is my 19th year at Archbishop Murphy High School. I view myself as kind of an accidental teacher. I had been in medicine, and my job in public health was winding down for lack of funding, and the principal at the time, Chris Smith, asked if I was busy because they just lost their biology teacher right before school started. And being an arrogant physician, I said, no problem, I can teach biology. So I started at the campus when we really only had one building and the portables. And Pat Jack was the chair of science at the time. And she plopped a biology book down on my desk and said, I really don't know anything about biology, but here's the book, and I know you should teach certain chapters at the end of the year. And that was it. And so I started teaching biology, and I was able to be very creative in what I was doing, and Pat was fully supportive, as was Chris Smith. And I loved it. I loved working with the kids. I could be very creative in how I was teaching biology, and I decided that I would stay the year. And at the end of the year, it didn't seem like Chris was looking for another biology teacher, and she asked me if I wanted to stay, and so I said I would. 6 years ago, Steve Schmutz and Alex Crane asked me if I would be interested in developing a health studies program for the school, and that was right up my alley. And I still had some contacts with Providence Hospital. My husband was a physician there as well, and so we went down. Alex Crane and I took a plane down to LA to visit Providence High School there, where they had a similar type program, a health studies program. It seemed like a great program. The kids they just were so well spoken. They had amazing experiences, and the alumni of that program were doing amazing things. And so that was kind of the start of the health studies program. So I spent a year or so working on that, looked at the Project Lead the Way curriculum as a way of supplementing that. And then with the help of the administration, we put together a package and presented it to the board, and they were very excited about the possibility. So we are now, this year, going to be graduating the first group, our first cohort. So we have 4 years of health studies classes, and I just think that the senior class this year is just a really good example of what we've been aiming for with the program. So I started out in medicine. When I was in high school, I got interested in medicine because I have a niece who was born with a pretty severe medical condition that required multiple surgeries and lifelong care, and I would go with my sister to her doctor visits and hospital visits, and that really inspired me to go into medicine, and just seeing how this made such a difference in her life. So I went to Marquette University and graduated from there in 1977, and then I graduated from the University of Wisconsin Medical School. While I was at Wisconsin, they encouraged us our senior year to do rural clerkships. And that's going out into rural communities for 2 months and experiencing what medicine was like away from the meccas, away from the big institutions that had everything. And so I went as far away as I could, which was to Bethel, Alaska, and I spent 2 months there working with Eskimos, flying to all sorts of Eskimo villages. I remember one day having to do anesthesia for a surgery. They just gave me a book and said, here's the machine, these are the buttons you push, and the patient survived. It was great. I did my residency in pediatrics in Albuquerque, New Mexico, because I wanted, once again, to do something as far away from Wisconsin as I could get, and New Mexico is pretty different from Wisconsin. And there we had everything come in the door, from general care to very high specialty care, and we took patients from all across the board. Then I met my husband as a resident, and we got married, and we came up to the state of Washington and started a pediatric practice from scratch here in Everett with the support of Providence Hospital and a family practice group that was next door. Because it was actually pretty crazy to think of people just out of residency starting a practice on their own. We built it up into a 4-person group, and then we became part of the Providence Medical Group in the 1990s. While we're doing all of that, starting a practice and practicing medicine and taking hospital call, we have 2 sons, and both of them came to Archbishop Murphy, and one of them, actually the older one, was a sophomore when I started teaching here. So I made this transition from medicine into teaching because it just got to be way too busy with both of us in private practice, having 2 sons and trying to balance life. So I had initially went into public health for 3 years, thinking that it would be a more 9-to-5 job. And then when that funding, after September 11th, funding for public health was cut drastically because of unfunded government mandates. And so then it just happened that I fell into teaching, and I've stayed here for 19 years. I think the reason why I stayed in teaching versus going back to medicine was that I felt that I could have a big impact for students. I felt pretty early in my career here that I had a good rapport with kids, and that what they really wanted in their education was to know, well, how is this important for what I'm going to do in my life, right? And so I really try and teach from the perspective that you're learning this because someday if you want to go into medicine or any other field, this is where you're going to use it. So I always try and show them where in their real life outside of the classroom they would be using skills and knowledge. Expanding on that with the health studies program, we can focus much more on the career options available. I think one of the reasons that really was important to me in starting the health studies program was I had several very committed students who wanted to go into healthcare, but they could only really think about being a doctor or a nurse. When they got to college, they realized that I don't want to spend 4 years in college and then 4 years in medical school and then 3 more years of residency. I want to accomplish something quicker. And so then they would go into some completely different area away from what had seemed to be their passion. And they would come back and visit and say, well, I kind of decided not to spend the time, and so I went into this area. And so in the health studies program, we hope to expose kids to all the areas of medicine that we can in healthcare, whether that be as a medical social worker or as a physician or as a speech therapist. There's so many career options available that could fit their passion and could fit their ideas of their future. And most of the kids that were my patients were very quiet about it, but then they would come and see me after school and they would talk about, I remember when you took care of me when I had this or when I had that illness. And there was a patient who, when she was born, was very ill. And I wound up having actually to resuscitate her, and she was very close to death. And I remember when she turned 16, she was in my biology class, which was so cool. And her mother and I sat down on her 16th birthday. Her mom came by, and we were just sitting there thinking back to that day when she was born, and we didn't even know if she was going to survive. And that here she was now at the age of 16, and it was such a neat experience. And it just still brings tears to my eyes when I think about it. So yeah, it was good. One component of the program that, as I've watched this current senior class, they have been able to do some amazing volunteer work, and that part of the program has been really meaningful. An example is watching one young woman who originally had a certain idea that of her path in life, and then she started to work with toddlers who were ventilator dependent, and it totally changed her world. And it was so cool to watch her become really excited and really find her passion. And the people that she worked with talked to her about the nursing field, and she got to really fully immerse herself in what that meant to be a pediatric nurse. And I think she's on a good path. So the program has been fabulous for helping kids find a career pathway.
So it's a joy to be back here in Dr. Wellenstein's old biology classroom, where I first walked in the fall of 2003. And one thing that comes to mind is of course Dr. Wellenstein's great knowledge that she would share with us often whenever we'd ask questions, and occasionally Dr. Wellenstein would kind of really go into some super detailed answers. And inevitably, as she must have noticed not just my eyes glazing over, but some others, she'd start kind of bringing it back down to earth. But it was evident, she really took a lot of time with all of our questions, and it was evident that Dr. Wellenstein really knows what she's talking about, but she also really cares about us. But I'd say the most important and really the thing that sticks out the most about Dr. Wellenstein was her humility, where she would often ask us questions. And not so much to trigger learning, though that was certainly a piece of it, but she was, in many cases, just genuinely interested in what we had to say and seemed like was trying to learn from us, which at the time struck me as odd because it was like, well, what do we have to teach Dr. Wellenstein? But over the years, it's become evident that Jesus, of course, is constantly asking questions in the gospel, and that Dr. Wellenstein is really teaching in a Christ-like way. And so we really want to say a huge note of gratitude to Dr. Wellenstein, not only for the great knowledge she shared with our Archbishop Murphy family, but more importantly, in the way she's taught in that humble, Christ-like way.